Your CPAP machine might be the most underrated weapon in your VA claim arsenal, and almost nobody's using it right. Let's start with the basics real quick because this matters. When you already have a service-connected condition, any other condition that is caused by, aggravated by, or a direct result of that primary condition can also be rated by the VA as a secondary condition. That secondary rating stacks on top of your primary rating. Sleep apnea is one of the most powerful conditions in the VA system when it comes to secondary connections because it affects nearly every system in your body. Your heart, your brain, your metabolism, your mental health. All of it. And most veterans just file for the sleep apnea, grab their 30 or 50% rating, and walk away. Big mistake. Now before I get into the list, I want to be very clear. I'm a veteran myself. I'm not your doctor and I'm not your VA attorney. What I'm giving you today is medical education about documented relationships between conditions. Understanding the medicine behind these connections is going to make you a much smarter veteran when you walk into that office. And if you need to connect with a licensed medical professional who can provide you with a detailed medical evaluation, VA raters actually look for. Click the link in the description box below to get started. It's the same starting point I started for myself and I recommend for any veteran serious about getting their VA claim approved. Alright, let's get into it. Number 1 on this list is hypertension, and this one should be on every sleep apnea veteran's radar. Here's the physiology. When you stop breathing repeatedly during the night, your body goes into a low-grade panic response every single time. Your sympathetic nervous system fires up, cortisol gets released, your blood vessels constrict, and your blood pressure spikes, night after night after night. Over time, this repeated cycle causes what we call sustained hypertension. The blood vessels lose their elasticity, the heart works harder, and the elevated pressure doesn't go away even when you're awake and breathing just fine. The research on this connection is actually very solid. Sleep apnea is one of the most well-established secondary causes of treatment-resistant hypertension. In fact, when doctors see a patient with high blood pressure that won't respond normally to medication, sleep apnea is one of the first things we look for. If you have a sleep apnea rating and you also carry a hypertension diagnosis, you need to be connecting those dots for the VA. Get your doctor to write a nexus letter specifically addressing how your sleep apnea is at least as likely as not contributing to or aggravating your hypertension. That phrase, at least as likely as not, is the magic threshold for VA purposes. Don't forget it. Number 2 is depression, and this one is so underutilized it's almost criminal. Veterans are already fighting an uphill battle when it comes to mental health claims, and many of them don't realize that their depression might have a clear physiological root that makes the claim much stronger. Here's the connection. Sleep deprivation caused by untreated or undertreated sleep apnea directly disrupts the brain's ability to regulate serotonin, dopamine, and other neurotransmitters that control mood. Chronic oxygen deprivation during sleep also causes micro-injuries to brain tissue over time, particularly in areas responsible for emotional regulation. So when you're waking up exhausted every single day, when you can't concentrate, when you feel like you're dragging through life with a fog that never lifts, part of that might not just be stress or military experience. Part of that could be the direct neurological and neurochemical damage caused by years of sleep apnea. The VA does recognize sleep apnea as a cause or aggravator of depressive disorders. If you have both diagnoses, talk to your doctor about whether there's a medical link. A solid nexus letter can open that door. Real quick, if you want personalized help understanding your VA benefits, increasing your rating, or avoiding another denial, join our Veteran Benefits Blueprint private school community. The link is in the description box below. Now, number 3, and this one surprises people, is erectile dysfunction. I know, nobody wants to talk about this one, but here's the truth. ED is extremely common among veterans with sleep apnea, and it's not just a coincidence. During REM sleep, which is the deep, restorative sleep stage that sleep apnea constantly interrupts, your body goes through hormonal cycles that are essential for testosterone production and sexual function. When you're not getting quality REM sleep, testosterone levels drop. Over time, this creates hormonal imbalances that directly contribute to erectile dysfunction. Beyond the hormonal piece, the cardiovascular damage caused by chronic sleep apnea also affects blood flow throughout the body, including to the areas required for normal sexual function. This is a real documented physiological connection. The VA does rate ED separately, and if your doctor can connect it to your sleep apnea in writing, that's additional compensation you deserve and probably aren't claiming. Get comfortable having this conversation with your healthcare provider. It matters. Number 4 is GERD, which is gastroesophageal reflux disease. Most veterans know it as acid reflux, and they've probably been dealing with it for years thinking it's just a diet issue or stress. But there's a direct mechanical relationship between sleep apnea and GERD that a lot of people don't know about. When you stop breathing during sleep, you create intense negative pressure in your chest and airway as your body struggles to pull in air against a closed or collapsed airway. That negative pressure literally pulls stomach acid upward into the esophagus, repeatedly, all night long. Additionally, the microarousals caused by sleep apnea episodes mean your body is constantly coming in and out of light sleep, and these transitions affect the lower esophageal sphincter, which is the valve that keeps stomach acid where it belongs. When that sphincter relaxes at the wrong time, reflux happens. Research has shown a significant correlation between sleep apnea severity and GERD symptoms, and treatment of sleep apnea with CPAP therapy often dramatically improves or resolves GERD in many patients. That symptom improvement is itself evidence of the connection. Document it. If your GERD got better when you started CPAP, that's a powerful piece of evidence for your nexus letter. Number 5, and this might be the most important one for veterans who are already dealing with heart issues, is atrial fibrillation. AFib. This one carries serious health implications beyond the VA claim, so please pay close attention. Sleep apnea causes repeated episodes of low oxygen in the blood throughout the night. Your heart is exquisitely sensitive to oxygen levels, and these repeated hypoxic episodes cause electrical and structural changes in the heart over time. Specifically, they cause inflammation and remodeling of the atrial tissue, which disrupts the heart's normal electrical conduction pathways. The result can be atrial fibrillation. The relationship between sleep apnea and AFib is now considered well established in the cardiology literature. Studies have shown that people with sleep apnea have significantly higher rates of AFib than those without it. Furthermore, sleep apnea dramatically increases the risk of AFib recurrence even after successful cardioversion or ablation. If you have both sleep apnea and AFib, and your sleep apnea is service-connected, this is absolutely a secondary condition worth pursuing. A cardiologist who understands both conditions can write a strong nexus opinion for you. Now here's something veterans almost universally get wrong about the VA claims process. They think they need a 100% bulletproof case before they file. That is not how the benefit of the doubt works in the VA system. The legal standard is that the evidence only needs to show your claim is at least as likely as not related to your service-connected condition. That's roughly 50-50. If a qualified medical professional can say, in their professional opinion, this secondary condition is at least as likely as not caused or aggravated by the veteran's service-connected sleep apnea, that opinion can satisfy the nexus requirement. You don't need a mountain of evidence. You need one credible voice stating that connection clearly. This is why getting a well-written independent medical opinion or working with a physician who understands VA claims is so valuable. The difference between a strong nexus letter and a weak one can be thousands of dollars a month for the rest of your life. And if you're ready to finally take control of your VA claim, stop getting denied, or you're tired of waiting years for a VA claim decision, click the ReMedical link in the description box below. They'll walk you through how to get the proper medical evidence and documentation for your claim. Don't leave benefits on the table. Take that next step today. It's the same starting point I started for myself, and I recommend for anyone serious about getting their VA claim approved. Let me also say this, the VA is not going to come find you. They are not going to look at your medical file, see that you have sleep apnea and hypertension and depression and AFib, and call you up to say, hey, have you thought about filing secondary claims? That is not going to happen. The burden is on you to identify these connections, gather medical support for them, and submit those claims. And the only way to do that is to educate yourself, which is exactly what you're doing right now by watching this. So, here's your action item coming out of this video. Pull out your current VA rating decision. Look at your service-connected conditions. Now think about every other diagnosis you carry, and start asking the question, could this condition be connected to something I'm already service-connected for? Because chances are some of those conditions absolutely are connected, and you're just not claiming them yet. And I will always recommend you to work with a qualified VSO, VA-accredited attorney, or claims agent to properly file your claim if you don't want to do it alone or haven't worked with one already. If you're tired of feeling lost in the VA benefit system, Hit subscribe and join thousands of veterans and families who are finally getting the answers, support, and confidence they deserve. And make sure to check out our Unlock More VA Money playlist linked in the description box below. Thank you for watching.